name is Rashmi Halker Singh, and I'm joined today by two of the authors of a recent publication in Headache entitled Protracted Headache After COVID-19, a case series of 31 patients from a tertiary headache center. So welcome to Dr. Leon Moskatel and Dr. Liza Smirnoff. I'm so happy to be able to speak to you about your work. First of all, can you tell me both a little bit about your project?
Yeah, thank you for having us. So just to give you a little bit of background, we started looking into post-COVID headache kind of as both Dr. Moskatel and I were in the beginnings of our fellowship in the beginning of 2020, and we started to see this new group of patients coming in who had worsening of headaches or a new onset of headaches after COVID infection. And as we kind of continued through both of our fellowship year and then into practice now, we've continued to see how this group has been specifically affected. And so we wanted to highlight this issue as something that we've seen in our patients.
So what did you find? Tell me a little bit about your findings.
So some of the most memorable parts of our findings include that we saw the diagnosis of chronic migraine skyrocket from 16% who met the criteria for chronic migraine before COVID to 65% who met the criteria for chronic migraine afterwards. And it took patients, 7 patients had headaches for 7.4 months prior to them seeing us. And overall, we saw a drop in full employment from 81% prior to COVID to 55% after COVID. And we also saw an increase in disability of 10% of patients who applied for federal disability.
So that sounds pretty significant. Were you surprised by any of these findings at all?
I think we were surprised by the magnitude of the shift. I think we were expecting more of patients who had no history of headache starting to have headache, but instead, really what we found is a lot of patients who had infrequent migraine just have their frequency and severity just absolutely go through the roof. And many patients had headaches every day of the month.
And I think another unique piece is that although obviously many patients have developed post-COVID symptoms, in general, a lot of our patient group actually had really mild infection, but then developed, either a significant worsening in their headaches or a new onset of headache that was really the cause of their disability rather than even any other sequela of COVID.
You mentioned it took about 7 months for patients to see you. Does that speak to the lack of access of headache physicians, or what do you make of that part?
I think that there's a number of different contributors to that. The first is that even when patients started to have a headache, it takes probably a few weeks before they recognize that, oh, this is something that is going on. I need to do something about that. And then once they work through their PCP and ultimately get referred to us, and as a tertiary headache center, we also receive a lot of referrals from neurologists who want specialized headache care. So by the time they work through the process, it's been about 7.4 months. And also part and parcel with that is the patients whose headaches resolved prior to that would not have ultimately needed our care.
And you might have mentioned this, but just to emphasize, were many of these patients people who already had a history of headache to begin with, who ended up with chronic, a chronic migraine phenotype, or people who really had no prior history of headache?
So the vast majority had a prior history of headache. 26 out of the 31 did have a prior history of headache. Most of those were migraine, and most of those were episodic migraine. There were a few scattered other types of headaches, but overwhelmingly migraine.
Given that it takes so long for people to see a headache specialist, what would you recommend for our clinician colleagues is it a good idea for these patients to be started on treatment early, or are there other recommendations that you might have now that you've looked at this literature in more depth and have the experience of doing the study?
Yeah, thank you for asking that. I think, since there is oftentimes a delay in care, and since this patient population has really suffered in terms of the high disability rates, we would definitely recommend earlier treatment, and ideally even screening for that by their PCPs when possible, especially in patients who've had the recent history of COVID infection and maybe have had a history of migraine. I think that they would be really benefited by earlier intervention.
And we had a little bit of limited evidence to back that up as well. 18 patients were started on preventative medications prior to them seeing us. 13 of those patients actually experienced a decrease in the frequency or severity of their headaches, and a few of them actually had a decrease in both after starting preventative medications. So many patients would benefit from earlier initiations of preventative medications to overall decrease their headache burden.
Well, I think that's great advice. Do you have any other recommendations that you want to add, or any other thoughts on this topic?
I think it's interesting to see, what role COVID will play on our headache population in the long term. And obviously that's not something we can kind of answer through this study, but I think we'll continue to expect to see exacerbation of headaches after COVID and potentially new onset of headaches. So I think that's just something for us to be mindful of as headache specialists with our episodic migraine patients, to see if there is worsening for them after infection.
And I think it's also helpful for patients to know they're not alone. We have started to see a lot of patients, an even greater number of patients now, who are in a similar boat, who had very infrequent headaches that have become more chronic, and being able to say, hey, based on our early information, if we start you on treatments, there's a good chance you'll get better. It can be very helpful. Obviously, our study did not look at efficacy of medications, but certainly starting to look like that might be the direction.
Yeah, absolutely. This is such a work in progress, and I think any data that we have to be able to help guide our clinical care of patients is really valuable. So thank you for what you've been able to contribute.
Thank you so much.
Thank you.